Mary Abbott Children's House is our local children's advocacy center. And what we want to guarantee anytime a child comes through our doors is that they feel welcome, they feel safe, and they feel normal. We provide forensic interviews, medical assessments, victim support, and educational outreach in the community. The multidisciplinary team here at Abbott House consists of all the people who have a stake in the case: law enforcement, child welfare, mental health professionals, medical professionals, advocacy center staff, and they gather to work on the case as one.
Before the Abbott House was here, the child would say, tell their story or disclose their abuse to their parent or a principal at school. And then the police would show up and the police would ask the child what happened. Then the child would have to just tell their story again to the medical personnel. And then the DA gets involved and the child has to tell their story to the DA. Having the Abbott House here, the child tells their story during the forensic interview, which is recorded and given to the proper people. The questions that they ask are very broad in nature and not leading the child to say something that maybe that they would not have normally said. And although maybe we're looking at different aspects of the case, the criminal investigation or the DHS investigation, we can all work together to do what's best for the child and make sure that the child's needs are taken care of.
We interviewed children for allegations of child sexual abuse, physical abuse, severe neglect, witness to violence, and drug endangerment. So it's important that they feel like this is a safe place, that they have some control in coming here, and it's important that we let them know that this is a place where they can talk and they can be safe while they talk about their abuse. And then bringing the child to the room, I always point out that there's a camera in the room, and also that there's people that I work with that are watching us talk today. And we do that just so that the child knows exactly what's happening.
I'm always very honest with kids that this is what I do. I see children who come here for different reasons than when they go to the doctor. Lots of times children feel like maybe there's something wrong with their body, so it's a great way for us to reassure them that everything is okay. It's very difficult for families to be here in the first place, so to ask them to go somewhere else or to see another provider or to make another appointment is sometimes just so overwhelming that parents just can't do it. So it's easier to provide as much care and as much service as we can when they're here all at one time.
I visited a place much like Mary Abbott Children's House whenever I was about 11 years old, and they really helped me move forward through my healing process. So that transparency and honesty with me was so important. I hadn't had that really before, and so I needed it. And the girl interviewing me, I remember I thought she was about the coolest person I'd ever seen, and she was very honest with me, very real with me, and really helped me to open up and to be able to share my experience. It impacted all of my relationships, but really the one that I think it impacted the most ended up being my relationship with my husband. I don't have to be, treated as if I'm broken or something's wrong with me or I'm unworthy or anything like that. I am not sure what I would have, internalized all of those things as if I hadn't had care and getting it out and having trusted adults be able to help me move forward.
We can't fix what we don't know exists. And so in order to get the children on the path to healing and get investigation started in an appropriate way, we train adults in the community with all the information that they might need on how to recognize potential abuse and how to report it to the authorities so that a case can be initiated and so that children can get out of that dangerous situation into safety and on the path to healing.